Good morning, everyone. We are going to give enough time for folks to come on, but I welcome you to the Managed Care Data Quality Monitoring webinar. We do this monthly, and this is our quarterly or semi-annual, actually, event. So welcome, and we'll give a few more minutes. Thank you.
Oh, twice.
Okay, it's 10:01. I'm going to give a couple more minutes. I still see people coming on. Appreciate everyone's active participation in the chat too. Let us know if you have questions or comments in the chat. Please feel free to use that. Give it a couple more minutes. Thank you so much. Hey, it's 10:03. I think that gives us plenty of time. I'll pull my computer a little bit closer. Yeah, go ahead and let us know if it's your speakers or my microphone. But yeah, there's always something. I can't unmute or work my video. Uh-oh. Paul, feel free to restart your computer. That might help. That's what I had to do. That's something that IT will always tell you. Did you restart your computer? All right, I'm gonna go ahead and I'll begin, but Paul is speaking. So Paul, if that happens, we can forge ahead and then be able to bring you back in. We might be able to bring you back in on the phone too. All right, this is a semi-annual data check and updates. We're going to be discussing the 274 medical data and the encounter data and the ECMCS and CCS JSON files and expectations, what's happening, what we're seeing. And we've got a great panel for you today. I'm Amy Peterson. I'm the Managed Care Data Support Section Chief. I have a wonderful production team that puts these programs on every month. Again, this agenda is going to be the semi-annual data checks, which we try to do twice a year, and then there's quarterly updates regularly on the quarters. And we're going to talk about frequent issues and warnings. We've got great speakers for that. The Encounter Data Improvement Project, which is something that I think everybody here at DHCS is really committed to. We want to make it possible for encounter data to be utilized better, and how we use it. It's really going to be able to help us define the project as it moves forward. ECM, CS, and CCM, this is the JavaScript, JSON Exchange information. We are really building out JSON files and getting moving, and we've got a wonderful panelist to speak with you today about what's going on. And then I'll go over, as usual, communication and resources, and we'll take your questions at the end. Next slide. Oh, here we go. The DHCS staff today, who are the speakers, are myself. Christine Fessler will be speaking to you. Paul Lee will talk about EDIP, and Janet Otto will go for a couple slides on ECMCS and tell you about JSON files. But Christine is going to be the one you really want to focus on today. Our support team, the production staff here, Abby Geber Selassie, Mei-Shan Ang, Samantha Van, and Xiaoyan Ma. And we've got Soo-Jung Kim kind of like holding down the fort and organizing everything. Please go ahead and mute yourselves. And moving forward, here we go. Just for general questions, please go ahead and submit your question to this WebEx chat, including comments about whether or not you can hear me. Please ensure that your questions are visible to all participants, because the person who is running the actual show, Abby, is not looking at the chat. He can't see the private chats. For specific questions, feel free to reach out to appropriate data mailboxes. They'll be published at the end of this presentation, probably within the next couple of weeks, but also we'll go over them with you and we'll discuss them and give you more information as you need. But specific questions are things that would only pertain to your company or your county. Next slide. Okay, I would like to introduce you to Christine Fessler. She is the Data Quality Reporting Unit Chief. She is fantastic. She's going to be speaking to you this section of slides about the 274 medical data quality monitoring. And she has information about lots of different areas, and she's just going to work through them. And again, feel free to ask questions in the chat, and then each section we can kind of hit them and see if there's anything that she can answer on the spot. And those kinds of questions we can add to our FAQs if they're not already in there. So we have a FAQ list, a fact sheet up on the web now, and anything that ends up being in this particular webinar will be added to that FAQ sheet if appropriate. Thank you so much. Okay, Christine, are you here?
I am here.
All right.
Can people hear me okay?
I
okay.
hear you good. Thank you.
Last time I had an audio issue. I have a new headset now, so hopefully I won't have any crackling or whatever's. So let's go ahead and kick it off. If we could go to the next slide, please. All right, so I kind of wanted to do an overview of kind of what is data quality, especially as DHCS has gone through reorg, you know, a different team. We now have the data quality reporting unit. And so I just kind of wanted to go over how is DHCS working to define data quality. Of course, I think many of you are aware, one of the primary resources that we will refer to are the all plan letters. So these help our team to define and enforce the standards to ensure the data submitted to DHCS is fit for use. And then we can look at, well, what exactly is fit for use? So in order to answer that question, we have to first kind of define, well, what is the type of data that we're working with? Is it encounter? Is it provider? Are we looking at rendering providers? So it's really those kind of questions too that help us better understand what sort of data quality dimensions and thresholds we need to be looking at. And then another important thing is identifying the stakeholders or who the key audience will be. Who will be consuming that information? Will it be internal, DHCS only, or both internal and external reporting. That also impacts the assessment of the data quality as well. And so now we get to the why of data quality. So I think we all know now that there is a positive correlation between data quality and the quality of healthcare delivery. For example, I will loop in the HSAT timely access study. So what they do is they take a sample of the 274 provider data, and if there is poor data quality, then they cannot sample as much of the provider data from the 274 files as they would like. And of course, with that might introduce response bias, sample biases, and therefore the outcome and assessment of their study. So the higher data quality that DHCS gets, the more trusted and beneficial this data will be for third-party reports and analysis. All right, so let's go ahead and go to the next slide. All right, so I'd like to say a picture is worth 1,000 words. And hopefully this is more of a pictorial translation of what we generally present as kind of all the files that are due when, as far as the 274 medical provider data. So what we have here is kind of a submission lifecycle of the various files that are due to DHCS PACES by the 10th of every month and then the 15th of every month. So what we have here are the typical files that are required to be submitted by the 10th. So in this example, it would be June 2024 data, and those files would be due to DHCS by July 10th. So what we have here in the top, going from left to right, top to bottom, one of those files is the MCPD file. So that one is due by July 10th for June data. And so what we have here is for that MCPD file, when the managed care plan submits to PACES, there is a response file that's generated. How do you know if the file is accepted or rejected? Well, you go to the response file and review it. So in this case, the managed care plan submitted the MCPD, the response file was accepted by or before July 10th, and therefore they would meet the DQ timeliness dimension, which again means a file has to be submitted and accepted to DHCS PACES by the 10th of every month. The other file listed there is the PCPA. Again, that file was submitted. A response file is generated to the plan's response folder in DHCS PACES. Again, the managed care plan team will look at that response file and whether or not it was accepted or rejected. In this circumstance, the PCPA file was also accepted, and therefore for that file, the PCPA, the managed care plan, receives also a pass for the timeliness dimension. Now, the other one here we have is the 274 medical. So what happened here? In this one, we'll say that the plan submitted July 5th. Well, in their response file that was generated from PACES, it says the file was rejected. So how does a plan go about knowing how to correct things? We have the companion guides at the DHCS Document Center. This is a very important resource that's being built out by Data Exchange, like Jeff Jennings, Janet Odo, and that team there. And they've been doing a really great job to make sure that the most up-to-date companion guides are available for the plans to download. So again, the rejected file, the managed care plan would go to the companion guide, and they would need to see what error code specifically resulted in the file being rejected. So in this case, as long as the managed care plan made those corrections and resubmitted the 274 file, we'll call it version 2 in the naming, that if they submitted that before July 10th and it was accepted, they would also meet the data quality dimension. Now, what we have here is the late is if a managed care plan submits any file after July 10th and if it's submitted and accepted after July 10th, it is considered late, and therefore that plan would fail the data quality dimension. The other file that also is submitted every month is the SRF, the Submission Reconciliation File. That one is due by the 15th. And so again, when the SRF is submitted, a response file is also generated and produced in the plan response file folder on DHCS PACES. That can be downloaded, and again, it will have a category or result of accepted or rejected. So in this case, the managed care plan passed the DQ dimension because the file was accepted or rejected. It was accepted by July 15th. So one of the key takeaways is this month in particular, there's a big technology snafu from CrowdStrike, and that resulted in some impacts to the queuing process, move it. So some files, didn't get uploaded. Those kind of issues, the DHCS works with the plans to make sure that the files get successfully uploaded and response files are generated. That's kind of different from if managed care plans are waiting until, say, the 8th of the month to submit the files. That might result in a file potentially being late if it was accepted after the 10th. And this is because sometimes within PACES, there can be very large queues, and the file processing time, if there's any sort of technology or network issue, could result in the file being late. So the strongly advised suggestion is to submit the files as soon as possible. You can also submit your files to the PACES test environment, and that way, know if your plan, if your file will be accepted or rejected. So if you want to submit your files to the DHCS test environment first, that mirrors production, and you will know if the file is accepted there, it will be accepted to production. All right, so again, technology is not always our friend, so please try to submit your files well before the 10th of the month. All right, let's go ahead and go to the next slide, please. All right, so this slide is just a kind of reminder of the resubmission guidelines. One of the data quality reports that we do send out, the monthly data checks, that presents 17 metrics, either a pass or a fail, and plans are, encouraged, required to resubmit their 274 data files. All of that, again, is explained in the companion guide as well. Okay, so let's go ahead and go to the next slide, please. All right, so these are our cart dimensions. We are currently in the process of also expanding these, but currently right now, our data quality checks include these data quality dimensions. So what we have here is completeness. We're looking at, and these are specified within the companion guide as well, do the medical files include all the required data elements, such as the provider last name and first name? Is that included? Is the site address populated? Please check the companion guide. This has all the information in there for the required data elements, or say the conditional data elements for these types of files. The other one is the accuracy. Do the data fields match the expected types, such as, are we accidentally putting in like an O for a 0? For the email addresses, is it, not spelled out .com? Is an O left out? These sort of accuracy measures is also what impacts the timeliness access survey. If there are incorrect phone numbers or the phone number formats are incorrect, this will be flagged in that timeliness access survey for DHCS to correct and speak with the managed care plans about. So the other one is reasonability. And then that is, does the data reflect what is expected? So for example, is there only one distinct organization reported on the 274? Essentially, you know, no sub networks are allowed. It's expected there's only one distinct organization. And then again, timeliness, that is the big one. For the files that we just went through on the prior slides, what files are supposed to be submitted and accepted by the 10th or the 15th of the month. All right, so let's go ahead and go to the next slide, please. All right, so how does Data Quality Reporting Unit, or DHCS, measure the data quality dimensions? So again, I mentioned the all plan letters. And so what DHCS has established is a threshold-based assessment of the 274 medical files submitted by managed care plans. We're reviewing, there are 17 data quality measures that review the data elements submitted in these files. And the managed care plans receive two type of data quality reports. One of them is a monthly data check, and that assesses the 274 medical data against threshold measures that are the CART dimensions, essentially, such as some measures related to timeliness, reasonability, those kind of things. What the semi-annual data check is it's a biannual assessment of whether or not managed care plans made improvements to any data quality measures that were flagged in the monthly data check. So these are sent out in July and then January. So we just sent out the data quality reporting unit, sent out in July the semi-annual data checks for the reporting periods of January 2024 to June 2024. And again, we're looking at the accuracy and the resubmissions. Those are incorporated in the semi-annual data check. Because again, it's a 6-month look back. So any sort of resubmitted files that a managed care plan did for corrections will be captured in the semi-annual data check. All right, so we'll go ahead and go to the next slide, please. Okay, I know this is a busy one. So this slide is trying to present how the monthly data checks are incorporated in the semi-annual data checks. So what we have here on the left-hand side is we have, say, an example managed care plan, their outcome, their monthly data check for March 2024. So all plans, when they receive their monthly data check, they have an aggregate or summary tab in their report that will show across all the HCPs that they may have. If they have more than one, those HCPs have an individual score for all the data quality measures. And what the summary table does is it will show across all the HCPs, if any one of the HCPs failed a particular score, then the overall managed care plan will receive a fail for that score. So in this example, this managed care plan did not meet the threshold for the safety net provider sites or the site email addresses. So what happens with that? Well, so what we do request in our communications with plans is if the managed care plan receives a fail score, we would like to know why. Is it a technology issue? Is additional training needed? Is going to have this information to see if there's anything that the data quality reporting unit could do to provide additional technology assistance or refer the managed care plan to another resource if it's another more complex type of technology issue. All right, so that's a monthly data check for there. So From the monthly data check, we would hope on the data quality reporting side that the plan would be able to improve its data quality over the next reporting months and turn the fail score to a pass. So that's where we would look at the semi-annual data check. So again, this is looking at a 6-month period. So more of a trend analysis of the managed care plan. And so specifically in this example, we see that in the March report period, the plan did fail that specific data quality measure. And then in the following month of April, they failed again. But then in the subsequent months, the last 2 periods of the semi-annual data check, they passed, which is really great. So the plan was able to improve its data quality score over the entire, the last 2 months of the semi-annual data check. So that's really great. That's what we like to see. Next slide, please. All right, so this is another example of, say, example plan 2. So what this is this a stacked bar chart of the data quality measures in the semi-annual data check. So I would focus on the top box. It's kind of orange, but the failing. So what we see here that in January, February, and March, the managed care plan failed 4 of the data quality measures. In April, May, and June of the semi-annual data check, they did improve the data quality somewhat. They're only failing 2 data quality measures, but we would definitely want on the data quality reporting unit side to meet with a plan over a call and bring forth any of our concerns and figure out what might be driving kind of the continued inconsistency in the quality of the reported data. All right, so if we could go to the next slide, please. All right, so this time around, we wanted to bring an analysis to the managed care plans of the first half of the semi-annual data check of what we're seeing as kind of the top issues or warnings of these data files that are submitted. So yes, thank you. Next slide here. So for the first half, what we're seeing is there are 24. So there's 24 out of the 25 plan parents or managed care plans that are having pretty significant issues with the site and provider member counts. So there's a lot of records that need to be addressed. Managed care plans do receive the flagged records report alongside the monthly data checks, and that is important to review. That's essentially a report that is warning the managed care plans of issues with the records. And again, this could be, email addresses are off, the zip code does not match, the site zip code doesn't match actually the address. So things like that should be looked at. And so let's go to the next slide, please. Okay, so this slide, again, I would like to say this is really the key takeaway from here overall is congratulations and thank you to the managed care plans. We see that the majority of managed care plans are passing the data quality measures and quite consistently so. So, we're looking at like 84% of the managed care plans are passing 11 of the 12 of the data quality measures, like in every month of the 6-month period of the semi-annual data check. So that's really great. It should be commendable. So thank you. We appreciate the collaboration. One of the things that we're seeing is that there are a few 2 to 3 managed care plans that are consistently not meeting the data quality measures in every period. So that's something, again, where we will be looking at, talking with those managed care plans and figuring out like what other resources they might need, kind of what's going on. So if we go to the next slide, what this is, so this is just a chart again of looking at of the managed care plans or the planned parents that received a fail score in any of the months in the January to June semi-annual data check are included in this chart. And then we also look at of those managed care plans or planned parents that failed, what percentage of months within the 6-month period did they fail? Did they only fail 1 out of the 6 months? Did they fail 2 out of the 6 months? So that is what the orange bar represents. So for example, going left to right in this chart here, this submission timeliness data quality measure, what we see here is that there were 4 plans, managed care plans, that had a fail score in any of the months of the reporting period. And then what we see here is that of those 4 plans that did fail, they failed 5 out of 6 of the months. So not great. Again, and this is, please try to submit your files well before the 10th of the month. Again, there are examples of managed care plans who have a lot of HCPs and are consistently able to successfully submit their files to DHCS PACEs in a timely manner. So it can't be done. Please try to get it done as soon as possible. The other one that to point out is the site and provider member counts. So again, this one is there 4 managed care plans that received a fail score for this metric, and then they did so 5 out of 6 of the months. So the site and provider member counts, it's really important that when we send the monthly data checks and the semi-annual data checks, there is a reference page. And if you go to slide, let's see, go to slide 18, that should be the next one. This is kind of a snippet of just one of the measures in the reference page that all the managed care plans receive in their monthly data checks and their semi-annual data checks, what the pass threshold is, and how the data quality measure is calculated. So please look at this information, understand how it's calculated. If you have questions about this particular metric, please reach out to the data quality reporting unit. That contact information will be shared at the end of this presentation. So we do provide this information. We hope the managed care plans are looking at it so that they can understand how they're being measured for data quality. And if there's any issues or concerns about how the calculation is, please also share that with our team as well. All right, so next slide, please. Oh, yeah, so this is again reaffirming flag records. Please look at them. We received that report, and please try to make corrections of any of the provider site addresses that you see. Please resubmit those files. It's really important. Again, I'll speak to that. This data is being used in the HSAG, the Timely Access Study. It does come back to DHCS if they let us know that there's a lot of provider data that couldn't be used in the sample because of missing information or incorrect formats. So it's one of the help us help you so that we can help the true beneficiaries of Medi-Cal. So want to make sure that we maintain a high quality, timely, and equitable access to the beneficiaries of need. So I think this is the last slide on my section, and I will happily turn it over to Mr. Paul Lee, a wonderful speaker, and has a wealth of knowledge as well on all things program and policy. So thank you very much for your time and attention.
Thank you so much, Christine. I did want to make sure that we had covered all of the questions in the chat. You did have a question. I feel like you hit it, but I just want to read it to you. We got a question. Do plans need to correct and resubmit if the file was accepted with warnings by the 10th also?
So that's where I think we can get into the SRF, but if the file was accepted by the 10th, you can resubmit after the 10th because you will meet the timeliness dimension when you have a file that's submitted and accepted by. Those warnings are still important to look at and understand. And again, the companion guide has all of the error codes and warning codes that are generated in the response file. And so yes, you can resubmit those corrections after the 10th. It will not be considered late, and that is part of the resubmission that is allowed. And again, that's explained in the companion guide, kind of the first section of the companion guide that walks through the file naming convention, the specific syntax that needs to be used when you are submitting the file, and then how to do the resubmission naming. So yes, thank you for the question.
Great. And then we got another question about, does this apply to PACE plans, which Jeff had posted the data exchange mailbox and the DHCS documentation center, and said that at this time, county behavioral health plans and long-term care PACE plans may not be required to submit certain files being referenced in this presentation, your presentation. However, clarification will be shared as needed. How would they receive notice if anything changes?
Yeah, so now specifically the data that we're talking about in this presentation is the medical provider data. So the managed care plan, the provider networks. So PACE organizations right now, they are submitting encounter data files. So that includes like the 837 institutional, the professional, any NCPDP files, as well as like physician administered drugs. So those files are different from the ones that I'm talking about in this presentation. The Encounter team did do a presentation, a webinar back in May that walked through the encounter data validation testing, which discusses the types of files that PACE organizations are required to submit to DHCS PACEs. So I would refer the PACE organizations to please watch that video. Amy Peterson and her team do a wonderful job keeping track of all the webinars and providing slides as a resource going forward for our plan partners. So yes, I would refer you to that site. And then if there is any sort of change in the requirements of the data required, I imagine that would come from an all plan letter. And I would refer myself and my team more to the, I think it's the chief of the ISCD team, because that's kind of more of a policy type of question about changes to data reporting requirements. So hopefully that helps a bit with the question clarification.
Thank you so much, Christine. We really appreciate your joining us today. And keep a looking at the chat for any other questions that might pertain to you. You can feel free to answer there too. We appreciate you so much. We are going ahead and we're moving to Paul Lee. Paul, you're here to talk about the Encounter Data Improvement Project Program. EDIP is what we call it here. Yeah. Paul is the healthcare delivery system specialist. He is reporting directly to a deputy here, so we will let him take over. Sir, please.
Well, you can see from my background that I'm up here in Yosemite, so if the phone breaks up, you know, you'll understand. Okay. Thank you. All righty. So I am a health program specialist. So I have a consultative role in policy, and particularly as it relates to all aspects of health data. And Christine mentioned that we've been through a reorganization. So all of the data quality work used to be in the same part of the organization in the program area that I'm in, and then we got reorganized. So the data has been separated out and is a service to the program. And so I am on the program side of it, and so we wanted to talk a little bit about why is encounter data so important to us? And I know a lot of people on this call have technical assignments. So I just wanted to stand back a little bit and just give a little bit of a perspective about the why of our work. And Christine, I think one of the things that I enjoyed about her really very interesting presentation there was the part about thank you. You guys, there's a lot of success going on here. A lot of things are being done really well. And I'll also just comment that I'm inspired looking at the chat because there's a lot of very constructive engagement and interaction going on here, and this is exactly what we want to see. Is we're a learning community. Healthcare data is very complex, and you never get it right 100% of the time. So there's always going to be some issues, and we want to surface those right away, communicate about them. And one of the neat things I noticed in Jeff's response to a comment, he's saying, "Hey, if you notice of any issues with on our site, let us know right away." And so, again, this is a learning community, which is it's an equal opportunity for improvement all the way around. Okay, so with that said, why is the quality of the encounter data so important?
We may have lost Paul. He is in Yosemite. Paul, are you back? Okay, we lost you for a second. When you said, why is the quality of encounter data so important? Okay, I'm going to continue until Paul comes on. Encounter data is used by CMS to evaluate the effectiveness of the Medicaid policies, ensuring the public trust and enabling innovation. And I think Paul could go into more detail around that. Yeah, I hope the bears did not get to Paul. Encounter data is used by DHCS to set actuarially sound rates, so identifying risk, evaluating quality performance, which is a lot of what we do here in our area, ensuring integrity and monitoring program compliance. Our team specifically does a lot of support for program compliance. Plans use encounter data to fulfill reporting obligations. We have dashboards, we have mandates. It is used to continuously improve the delivery systems and collaborate with partners. One of those things that we are doing here is trying to reach out to our partners. And Paul, if you can come back, you can
Looks like
take
I'm
this
back.
over. I'm on the last bullet.
Yes, I see it on down to providers.
Feel free to elaborate on anything that I've been able to say and speak to here.
Okay,
Thank
great.
you, sir.
Let's see, I'll just hit a few things quickly here on this. So in CMS, one of the things CMS put out a toolkit on improving encounter data. And one of the things that I really liked about it is it emphasizes collaboration. So particularly for the state to really act as a liaison, get involved with everybody in the encounter data ecosystem, and work collaboratively. So a lot, it starts with good communication, open, transparent communication, and good working relationships. So engagement is something that CMS is emphasizing, and we're prioritizing. And so that'll be a thread through my comments, and we look forward to hearing from you about ways we can engage that will be the most helpful to you. So that's an open ask. Doesn't have to be all today, but going forward, that we very much want to have those kind of conversations. Now, one of the things that's interesting in my role, I'm a liaison across program areas. So, I meet with and learn from and connect with all the different program areas that are using encounter data to run our organization and to serve you and serve your organizations. So, encounter data is essential. We're per member per month capitated rates. So to get that right, you'll have to have really good quality encounter data. So you could think of it as the budget for your organization, largely is based on that you provided good encounter data. It's very interesting, this whole area of ensuring integrity. So, our audits and investigations division, it's really interesting because they have a kind of a customer service philosophy. So, if they find something, an anomaly in the data, they're very good at reaching out and saying, "Hey, were you aware of this? What's going on?" and really connecting with people to get solutions. Okay, so now this is related to CMS. So this is what we call the wall of shame. And I don't know if any of you have seen this. It's the Data Quality Atlas. But the good news is we're getting better. So we were in the red for years, and now we're in the yellow. So we've been moved down from, we don't have critical faults as far as CMS is concerned. So a big pat on the back for everybody. This is a recent development. And so the idea here is let's continue the momentum. And so what we do have is we're in the yellow because there are some what they call high priority data quality issues that CMS flags. And so we want to keep on working on those several categories. And then we want to get into the blue, and we really want to get off of the CMS radar. Keeping in mind that the federal financial participation in funding our organization and through us all the plans is it's contingent on data quality. So CMS really pays a lot of attention to this. And again, they're not trying to bring the hammer down. They're trying to get us all to work collaboratively towards improvement. Okay, next, please. Okay, so we have, as an agency, been looking at what can we do better, and we've been working with the plans. So the Encounter Data Improvement Program is a very interesting because it's grant funded actually by a community benefit grant from one of the plans, which we're very grateful for, and then that is matched by federal financial participation. So. Everybody's chipping in here and so what this will be is we will have vendors working directly with providers to identify and remediate encounter data issues. So, when you see these reports and there's something that's flagged and it was a fail, we want to get in there, roll up our sleeves with you, and figure out how to get this right. There will be a third-party administrator, so the department won't be working directly with providers. Typically, we relate directly to the plans. The plans relate to the providers. In this case, there'll be a third-party administrator handling all those arrangements. And we will So this is, one of the interesting things that came out of a lot of the engagement in the planning for this is encounter data. It really comes out as an ecosystem. So you start with the electronic health record, and you start really with the member coming in and presenting an issue. And then that gets translated into the claims and billing. It gets submitted as encounters. It can go up. It can go through a clearinghouse. It can go through a health information exchange. It can go through delegates and subcontractors and to the plan, and then to us. So there are a lot of people touching it, and there's a lot, with a lot of moving parts like that, there's a lot of issues that can happen. So, what we're doing is we're looking at this as a holistically and engaging, and we're really doing it. It's a sort of a bottom-up approach here of getting the vendors connecting with the providers and what are their issues, and then how do we support that. Okay, and we will can go back one, and I'll just wrap up there. I'll make it brief. Okay, so the other thing here is I'm going to date myself. So, back in the 1990s, it was very big to talk about reinventing government. So I guess government's been reinvented. What we're doing now is we're not reinventing, we're refreshing. So if you recall, there were the QMed reports were similar to what Christine presented before in terms of using different dimensions, the CART dimensions, and setting thresholds, and then giving that feedback to the plans. So this is now we're reworking that, and we're going to bring it back. It was suspended during the pandemic. There's some things that really had to be worked through here. For example, we carved out a lot of the pharmacy benefits. So we have to take that out of what we're reporting to the plans on encounter data. We are then expanding the scope from the classic CART, completeness, accuracy, reasonableness, timeliness, some new dimensions, which will be filling in more information in the future about the uniqueness of the data, the consistency of the data. And we are focused on technical assistance processes and engagement. So when this comes back out and you get the report, then how do we work with you to work through any issues that come up? And so please be on the lookout for an all-comers webinar later this summer, when we will be expanding on the details of these programs. And that's what I have.
Thank you so much, Paul. I really appreciate your thoughtful discussion about some of the challenges that we face and some of the things about how government has changed and how we're governing the data differently and stewarding the data differently, and looking at it from as many perspectives as possible to kind of understand how people are using it and how people need it. I really appreciate how you and Christine have both kind of focused on that. And now we're going to focus a little bit on how DHCS needs the data to come in and what it would look like, and some examples of what that process is. And so I would like to welcome Janet Odo, who is our Data Exchange Integration Unit Specialist. She has been leading the charge for ECMCS and CCM JSON Exchange, and really project managing that to fruition. I would love for her to be able to engage with folks here and be able to speak to you a little bit more about what we're seeing and how it's coming in and what we're doing with it. So Janet, welcome. I hope you're here. Otherwise,
Yes,
I said all
I'm
that
here. Okay.
Welcome, Janet.
Thank you. Can you guys hear me?
Yeah, thank you.
All right.
Yep.
Okay.
Yep.
All righty. So, yes, I'll be talking about the ECMCS CCM JSON Exchange. This is a new exchange. We're basically getting Excel spreadsheets and bringing them to more futuristic machine readable format, which is the JSON. Next slide, please. So as many of you have seen in some other webinars that we've had, this is the timeline. So basically phase 1 has already come and gone, which was started in January. We had the enhanced care management, which was the 2 SINs, the complex care management SINs and the ECM SINs. And so we basically got the spreadsheet, and instead of doing it all in one phase, we kind of chunked them out. So it's a lot, hopefully easier for the managed care plans to kind of report in phases the data versus everything at once. So our phase 2 starts in June 2024, which we're currently in. We're in the testing phases, and then in August it goes live. So in all of the phases, we do have a testing staging phase that managed care plans can, test and ask questions. So when we go live, couple months later, that it's a little bit easier to transition. So phase 3 we have in December, and that's the community supports population of focus there. And then phase 4 is April 2025, and that's new data elements for JSON, which is not on the QIMR, and that's the complex care management data elements. So at that time, once all the phases go through, the plans will be reporting both JSON and QIMR Excel templates simultaneously. So this will probably keep on going on for like a year and a half or so until we kind of get used to everything, do the quality checks, and then make sure everything is running smoothly. Then we will then eventually turn off the QIMR. I see a question in the chat. It says we will be receiving an updated documentation card when CCM elements will be included. Yes. So yes, Lisa, there will be updates to each of the phases, and usually a couple months before we'll send out the slide, the technical documentation and then data dictionary prior to each phase and ask you guys for feedback. And then from there, we'll make corrections or whatnot. And then we'll send out the final ones couple months before each phase. So hopefully that answers your question. All right, so the ECM CS CCM JSON Exchange, there's some important information. So important dates. So we have testing staging, which started June 2024. And as I mentioned, production starts August 2024. Next slide, please. So here we have some important resources, as Christine had mentioned, that we do have a documentation center, and Jeff Jennings has placed in the chat. This is the data exchange mailbox. If you do not have access to the documentation center, please email that mailbox and we can get you access to the documentation center. So here, once you guys receive the slides, there'll be hyperlinks here to the documentation center overview, also technical document guide, and then also the data dictionary. So this is just for the ECM. However, I don't know if you guys can see, there's a Teams view of the doc center. This is what it looks like in Teams if you have Teams. You can see the documentation. There's a general. That's where you'll find the documentation overview. Also, there's Catman documentation, EFT enrollment documentation, MCPD, PCPA, PACES guide, program template, which is where you will find a lot of the ECM information here. It says JSON, short DOIL, medical, and then source documentation, which you guys will not have access to, and submission reconciliation forms. So all this will be available to you once you receive access to the documentation center, but most of you will probably see it in the SharePoint view, which is kind of hard to see because it's kind of tiny, but it's information that you see here in Teams, but it's just in a different view. So inside of that, once you get access, please look over the documentation overview. It gives you very good information on how to maneuver within the documentation center and where to find things. And I see we have, okay, so Annette is asked a question, how does a county gain request access to the Teams view of the doc center? You just send an email to the EDM data support. If you have Teams, it should allow you to view it in that view through your Teams, but just depends on how everything is set up on your end with your ETS. And okay, so any other questions that we have here?
Janet, if it's okay, this is Jeff. I'm just
Hi.
going to jump in for a minute.
Sure.
Yeah, we've seen that sometimes the links we share resolve to SharePoint rather than a Teams view. If you are having any issues with that, let us know. Whenever we're sending links out, we always work to ensure we are sending you a Teams-based link, but occasionally that doesn't happen. So given the relationship between the two applications, that's kind of how it turns out. Again, if you do have any issues with that, let us know and we'll work to get that resolved for you. And if you absolutely can't access the docs, we will find other ways to distribute those to you, usually via email. There are some file formats that are no longer able to be shared via email due to enhanced email security. And we do have other solutions to address that as well. So our objective is to make the documentation center and the documents easy access for you. But if that's not working, then we have alternatives as well. So thank you. Thanks, Janet.
Oh, no problem, Jeff.
Yeah,
Jeff-
as a matter of fact, to
Jeff-
demonstrate, the link that Sujung just put in the chat is a SharePoint link. And we're still trying to understand why this happens, but it does. So just be advised that it may either resolve to a view that is not Teams, in which case everything is arranged in folders in the usual SharePoint way, or you may get an access issue with that link. So again, if so, please contact that mailbox and we'll do everything we can to resolve it for you.
Definitely.
Thanks.
You have a question?
We had a question about counties getting access to the documentation center.
No problem.
And that it's the same email. It's the
Yes.
same email.
Yeah, it's the same. Yeah, it's open to any of our trading partners. And just send an email and we'll get you hooked up. I will say for county plans, most of your documentation has been stored in the BHIS SFTP center. That will remain the case for companion guides, etc. But we will eventually be posting behavioral health related documentation to the doc center. We just have been trying to avoid confusion, double postings, and things like that. So as we continue to change as an organization and integrate more fully, we are working to have a central place for documentation. The doc center is open to county plans. Please let us know. We'll get you started on that, and then eventually be adding other behavioral health related documentation. Thank you.
Great. Thank you, Jeff. And so Jeff's team puts together the documentation center and also a lot of the documents that go in there. So yes, thank you so much for the information. And I see John, will DHCS allow additional days for testing considering we'll be releasing a new schema version when JSON phase 2 is going live? We were told to use version 2 in testing. Yes, so there is up to today, you'll be using 2.0. There's also an email that will be coming out with all this information, but starting August 1st, there is a 2.1 schema and also an updated technical guide. And yes, email will be coming out, I believe today or tomorrow, from at the EDM support mailbox or the data exchange mailbox. So be on the lookout for that. It'll have a table of all the different elements that were updated, and please use that as reference. Also, Noreen stated that, is there a JSON schema file for ECMCS? We could not find it. Yes, so if you go, can we go back one slide, please? If you go into this program template data file, and it states JSON, within there are schemas and also the tech guides for that. And let's see, Jacqueline, good idea. Okay, so I think we've answered a lot of the questions, but if you have any other specific emails regarding the ECM JSON Exchange, please contact the Eden Data Support mailbox here, and then you can ask us anything about the ECMCS CCM JSON Exchange. But however, if you do need access to the documentation, please send it to the email box that Jeff put in the chat. And I think that's it. Thank you.
Thank you so much, Janet. Really appreciate you coming on and discussing the ECMCS information. It does have application across all of JSON files, and a lot of what you are doing in testing has been done in other areas of our data exchange. I'm going to go ahead and talk about communication and resources. I do want to kind of give enough time so that if people have any other questions, we can get through them. But go ahead and post your questions in the chat. I also did ask if you want to share your role and your email and your name with us. It would be nice to know who our participants are, and we can either accept that in the chat or at mcdss.ca.gov if you're a little shy. But folks, we don't have a lot of information about our audience yet. So it'd be nice to have that. Managed care plans, contact guidelines. Managed care plans are limited to 4 plan contacts. Those folks include a primary technical contact and a primary compliance contact. And you really do not want to have this be an all resource email contact box that a lot of people can access. You want to assign a liaison to DHCS from that managed care plan, and that liaison should be able to distribute your information appropriately and know who to get it to. Next slide. All plans have assigned analysts here, a primary contact and a backup contact. And if you're not sure about who your current analyst is, please do reach out to the provider box for clarification, and that's MCQMD provider data at dhcs.ca.gov. And that will let you know who your folks are from your side of the house. Here's a lot of the communication that is really useful for folks, the data group mailboxes. This is really where you should click and poke around on. We're going to have a separate web page that has all of our communication boxes and the definitions of what is appropriate to send to them. But the 274 medical physical health, that information would go to MCQMD provider data. 274 behavioral health plans, that's for MHP and DMC-ODS folks. That goes to the 274 expansion at dhcs.ca.gov. Dental goes to DMC deliverables at dhcs.ca.gov. Encounters, please send that to mmcde for encounter data@dhcs.ca.gov. Behavioral health, short Doyle, is medccc@dhcs.ca.gov. So you can see how it gets a little bit confusing for you, for us as well. And we want to make sure that it's pretty clear that everybody understands what the role of the resource mailbox is and what they're accepting. DHCS Documentation Center access requests always should go to Data Exchange. The information that Janet's slide was sharing was about specifically ECMCS. And technical questions for ECMCS, again, go to that EDM data support at dhcs.ca.gov. And then anything about this webinar, please send it to MCDSS webinar support. And we're at also dhcs.ca.gov. And if this message is urgent, please mark it urgent. I did see that there was an email sent that had not been responded to. Someone had posted that in the chat. Please post that again and mark it urgent and send it to the appropriate mailbox, and I'm sure they will be on the lookout for it today. Next slide, please. Folks who have been following us for a while know that we have been doing this for a year and a half. And the resource page that we have put together is very robust. We get quite a bit of feedback on it. We appreciate your feedback. What do you find useful? What is helpful? What do you use the most? And then quality measures and reporting will take you to the quality measures, our quality webinar series, which lists everything in detail down you scroll down through it, you get both years. Anything that's coming up and that we're planning to do, if we haven't covered it completely in the previous year, we may hit it again, but we are in the process of modifying and trying to be less repetitive and more helpful and useful to the folks who are submitting this data, as well as to the folks who are using this data. Next slide, please. Those resources, again, list out every single webinar that we have hosted, that we have completed to date. This will take about, I don't know, Abby got it done really quick last month, but maybe a week to 2 weeks, depending on the web team that's doing the analysis of it, before they actually will approve it to post. So this webinar series page has some emails. It has access to all of the YouTube videos that we post for all of these webinars. It has the slides. It has transcripts. It has what else? Just all of the dates, all of the information, and the folks who are presenting. You can use this if you need to for training. You can use this for information. You can download slides and get that live link for somebody that you know you need. And again, we're going to be expanding our universe a little bit and creating a web page exactly for that purpose. But on this page, we have an FAQ page. So a lot of your questions get incorporated. Another thing that we have is a glossary of terms, because I know I get confused. And then anything else that we can think of that would be helpful to you, including the data exchange email that will get you access to the documentation center itself. All of that is listed live on this page. It is as robust as we have been able to make it to date. Appreciate any comments or suggestions to make it even better. Next slide, please. This is a discussion about the DHCS data collection status. As you saw, there's a lot of information that is coming in. It gets rejected or it gets accepted. There are a lot of things that are in production already. This particular slide keeps you up to date on what is the status of the data collection going forward. A lot of what we do is currently in production. It is moving forward. Next slide, please. Okay, I would like to open this up to questions in the chat, and I will kind of go up the chat a bit to see what we've got. I like that folks are putting in information about audience participants. I really appreciate that. Janet is thanking everybody for being very patient with all of us here. Is there a recommendation for tools that can convert Excel files to JSON? I think that is a lovely question from Plumas. Janet or Jeff or Christine, is there anybody on who can answer that question to date? Because it's not like you can just convert it. So is there a way to do that? I know that there is documentation center information about like the positions of all of the data, but is there something that they can use? And I know that I'm sorry, go ahead.
No, I was gonna say I think this might be an opportunity for potentially another webinar topic. I know that we are hoping to get kind of more into the weeds of the response files specific to encounter data. So I mean, it's outside my scope, unfortunately, but I can reach out to the PACE's technical team. They're actually the experts and software engineers. The only thing I could say there, I use Notepad++. That just has there's a add-in, I believe, but that's just like if you're wanting to check if JSON is a correct format. Or editing in JSON. So apologies, but I'll see if I can find out and then we can give some guidance.
Thank you, Christine. Same ditto, exactly what you said. I use Notepad+ just to check, but yeah, I don't know anything off of the top of my head that will actually convert the Excel template to JSON. Yeah. We'll have to touch bases with the ETS side.
Let me see. I'm going to go back up here. I'm going all the way up. Okay, let's see. Do we have an estimated timeline for receiving a response from the EDM data support at dhcs.ca.gov team, or any indication of when we can expect to hear back? So, Janet, is there like a couple folks who are looking at that resource email box and able to respond relatively quickly? And what would that time frame look like? Is it a day? Is it a week?
Usually they respond 1 to 2 days. If you haven't heard, please email us back because it is a shared mailbox. And so we want to make sure that, you're being heard and your questions are being answered.
One of the things that we suggest to our participants on this webinar is to mark information urgent if they have something that's urgent. So marking it urgent in the subject line can really help bring that up to the top faster. And that, I think that has helped a lot in a lot of different mailboxes. Okay, thanks everybody who's putting their information. I really appreciate it. Oh yeah, no worries to folks in Plumas. We understand too. Let's see. Oh, somebody mentioned check out ZappySys. I've never heard of that. What process does the plan need to take for the exemption process for a MDC failed category for the 274 file? That's a really good question. And is there a process for failed category for the 274 file? Is there an exemption process? You know what, Song, I think I'm going to take that back, and Lisa has already said not to her knowledge. That's a really good question. We'll add that to the FAQ. Not to our knowledge. Let's see. I think that's it. Oh, Excel to JSON library, which is Python library. Okay. Thank you, Ahmad. We'll keep some of these handy for folks. Any other questions? Again, feel free to email us your contact and role information. Really appreciate it. Or you can post it here and we'll capture it. Thanks everybody for participating. This almost went a full 90 minutes. I'm about to give you back 10 minutes of your time. And thank you for engaging so nicely with us. Like, we just really enjoy being able to have that camaraderie and sharing information with folks and making those connections. And thank you to Paul and Janet and Christine. Really good information for this July month webinar. Really appreciate you all.